Hi everyone, welcome to Medici by Lakshmi. So today I'm going to teach you necrosis, the definition, what are the types of necrosis, and one of the type is gangrene, dry and wet gangrene. We are going to discuss in detail. Okay. So first we are going to study the definition of necrosis. Necrosis is, in simple words, is just unregulated form of cell death. Let's dive into the proper definition. Necrosis is a pathological process. It's just a pathological process. It is characterized by a localized area of death in a living tissue as a consequence of severe injury. It is produced by progressive degradative action of enzymes following harmful injury. So what did you understand from this definition? First of all, we have to know it is a pathological process only. It's not physiological. Apoptosis was both physiological and pathological, but necrosis is purely pathological. And what is a characteristic feature? It is localized area, characterized by a localized area of death in a living tissue. And it's because of severe injury, not small injury, because of very severe injury it's going to happen. And it is produced by the progressive degradative action of enzymes. So when we are having a heavy injury, the progressive degradation action by the enzyme is increasing, leading to the localized area of death in a living tissue. And it is a pathological process. Whenever a pathology is happening only, this is necrosis is going to happen. Is it clear? Now let's move on to the morphology. Suppose we are observing a necrotic cell under a microscope. The cytoplasm is going to be highly eosinophilic. Eosinophilic means it will be very pink in color. And the appearance will be a glassy and homogeneous appearance. Okay. And in some slide we can see dead cells may be replaced by large walled phospholipid precipitates. It's called the myelin figures. Sometimes we can also see myelin figures replacing the dead cells. Myelin figures. Now let's move on to our next topic. One more thing, and under it can be seen as a moth-eaten appearance. And importantly, we can see three types of nuclear changes. Any one of this will be we can observe. One will be sometimes it may be a pycnotic cell, pycnotic nucleus. How a pycnotic nucleus will look like? It will be shrunken. Basophilic will be increased. More blue color will be there. And pycnosis also observed in apoptosis also. And karyohexis means now the pycnotic cells, the nucleus is going to get fragmented. And karyolysis means the fading of the basophilic staining of the nuclei. The basophilic staining will be reduced in this karyolysis. So these three type of cells, nucleus can be seen in a necrotic cell under microscope. And under the electron microscope, we can see a large amorphous densities and also intracytoplasmic myelin figures. I have already discussed what are myelin figures. The dead cells may be replaced by a large walled phospholipid precipitate called the myelin figures. Now we are going to study about the types of necrosis. So the first type is coagulative necrosis. The note is a little untidy, but trust me, I will explain it in detail. In coagulative necrosis, first of all, the tissue architecture is preserved. The morphology of the thing is not going, its organ is not going to change. The tissue, the basic architecture of it is preserved. And also CNS coagulative necrosis is a characteristic of infarct. Whenever infarct, if you are seeing an infarct, it is a characteristic feature of coagulative necrosis. And also it is present in all solid organ. This is very important. It's present in all the solid organ except CNS, brain system. All the solid organs means heart, kidney, spleen and lymph. And what may be the cause of coagulative necrosis? The cause may be ischemia and hypoxia. And coagulative necrosis is one of the most commonly happening necrosis, and the mechanism of action you have to study it. It's denaturation of proteins. It's because of the denaturation of proteins. And gross features we can observe a wedge-shaped infarct. It will be very firm, but with progress it will become yellow, soft and shrunken also. And microscopic feature, it will have tombstone appearance. It is multiple ghost cells. We can see multiple ghost cell. I will try to add a picture over here from Robbins, which will show the tombstone appearance, or you can refer to Robbins diagram also. And also preservation of basic outline of the cell. Example, we can see it in myocardial infarct. We can see this thing. Now the second type of necrosis is liquefactive necrosis. It is also called the colliquative necrosis. Here the dead cells are getting digested. The site where is it happening is brain and pancreas, where there is high enzymatic levels, and also here the tissue architecture is lost. And appearance, grossly we can see it as soft. It will be very soft. It will have a liquefied center. This liquefied center will be containing necrotic debris and pus. It is also seen in wet gangrene. It is a type of liquefactive necrosis. And example, abscess. In abscess we can see this, and microscopically pus cells will be present. And this pus cell will consist of dead leukocyte, necrotic debris, etc. Oh, sorry, I couldn't see. Causes ischemic injury to the CNS, or bacterial or fungal infection also is one of the cause. And what is the mechanism of action? Now I told you the dead cells are getting degraded, right? Now mechanism of action is tissue degradation by hydrolytic enzymes. This hydrolytic enzyme is produced by whom? Released from the dead cells. Dead cells are releasing these hydrolytic enzymes which are degrading the tissue. This will produce a liquid viscous mass. That's all about the liquefactive necrosis. Now the third type of necrosis is caseous necrosis. Caseous, it's like cheese-like appearance, friable white appearance, and it mostly occurs in TB infections. People with tuberculosis will have this caseous type of necrosis, and it is combination of feature of both coagulative necrosis and liquefactive necrosis. Microscopically we can see first it will be very eosinophilic, and and amorphous debris we can see, and it will be presence of granuloma will also be there. And the common site of this happening is lung and lymph node. Now let's study about the next type. Next is fibrinoid necrosis. It's seen in immune reaction which is involving any blood vessels. Okay. And now this antigen antibody complex are lodged in the wall of arteries. So when they are lodged in the wall of arteries, it is gonna block. And also with fibrin, in this type of necrosis, the fibrin leaks out. It will form a bright pink amorphous stain. While looking at microscopically, we can see a bright pink amorphous stain around the blood vessels. I'll try to include the picture over here, or you can refer Robbins. And our fifth type of necrosis is fat necrosis. It can be both enzymatic or traumatic. Enzymatic, it's basically focal areas of the fat destruction. Where are the main focus areas of the fat destruction? This type of necrosis will be happening. And one of the examples, it will be seen in acute pancreatitis. We can see microscopically the fat cells will be appearing as pale with shadowy outlines. And grossly, it will be gross. You have to study by chalky white appearance. Will be seen chalky white appearance. And how the mechanism. So this I said that it's happening seen in acute pancreatitis. We'll just see in that. Activated pancreatic lipase and peritoneal cavity will be there. It will release some enzyme. Now the enzyme liquefy the peritoneal cavity. Now since it's liquefying the peritoneal cavity, that will split the triglyceride into fatty acid. This fatty acid will combine with the calcium, and saponification will be happening, hence leading to the chalky white appearance. And this saponification is very helpful for surgeons also. And one of the examples for traumatic fat necrosis will be breast trauma. Next is gangrene. I'll be teaching you it from our textbook. Okay. So gangrene, it is of both dry and wet type. General features. Common site for dry is it will be present in the limbs, wet in the bowels. Example for dry gangrene, gangrene of lower limb due to atherosclerosis, wet volvulus or intussusception. I just studied the volvulus. For exam also I wrote that. Etiological factors, what are the cause of ischemia in dry? It will be arterial obstruction, whereas in wet it will be venous obstruction. Rate of obstruction will be slow for dry and it will be abrupt for wet. Gross features, appearance of the involved part, it will be very shriveled, dry, mummified and black kind of appearance, while wet will be swollen, soft and moist wet appearance. Line of demarcation, there will be clear cut The demarcation, there will be demarcation, clear cut demarcation present, but in wet it won't be present. Spread, it is very slow for dry, and wet it will be rapid. Prognosis, dry has a very good prior prognosis, wet it is poor due to severe septicemia. Okay. So this is a type of coagulative necrosis, and as I said, I'll show the image. It's not clear. So this is the tombstone appearance. This will be a normal cell. This is the necrotic cells. Normal cell, we can see a lot of nucleus. In the necrotic cell, it's, see, it is like ghost cells. It's like many ghost cells are there. So we call it the tombstone appearance. And this is an example of liquefative necrosis. As I said, the gross features, it will be soft and it will be liquefied in the center. It will may contain the pus cells. It's affected in the CNS areas. And this is the chalky white appearance which is seen in fat necrosis. Okay. Now this is looking like cheese, right? Cheesy like appearance is seen in caseous necrosis. And this is what I said, amorphous pink stain seen in fibrinode necrosis if an artery. And that's it for today. Thank you one and all.